Question 1. A patient is diagnosed with a urinary tract infection, UTI. Which symptom is most commonly associated with this condition? A. Dysuria. B. Bradycardia. C. Hyperglycemia. D. Hypertension. Answer: A. Dysuria. Rationale: dysuria, or painful urination, is a common symptom of UTIs. The other options are not typically associated with UTIs. Question 2. A nurse is caring for a patient with tuberculosis. Which type of isolation is most appropriate for this patient? A. Contact. B. Droplet. C. Airborne. D. Standard. Answer: C. Airborne. Rationale: tuberculosis is an airborne disease, requiring airborne precautions to prevent spread. Question 3. A patient with HIV is receiving antiretroviral therapy. What is the primary goal of this treatment? A. To cure HIV. B. To improve symptoms. C. To reduce viral load. D. To increase white blood cell count. Answer: C. To reduce viral load. Rationale: antiretroviral therapy aims to reduce the viral load, which helps in controlling the disease. Question 4. A nurse is educating a patient about preventing Lyme disease. Which advice is most important? A. Avoid wooded areas. B. Check your skin for ticks after outdoor activities. C. Wear short sleeves and shorts. D. Use a humidifier at home. Answer: B. Check your skin for ticks after outdoor activities. Rationale: Lyme disease is transmitted through tick bites, so checking for ticks is essential. Question 5. A patient is diagnosed with Clostridium difficile, C. diff. What type of precautions should the nurse implement? A. Airborne. B. Droplet. C. Contact. D. Standard. Answer: C. Contact. Rationale: C. diff is spread through contact, so contact precautions are necessary. Question 6. Which vaccine is recommended to prevent hepatitis B infection? A. MMR. B. Varicella. C. HPV. D. Hepatitis B. Answer: D. Hepatitis B. Rationale: the hepatitis B vaccine is specifically designed to prevent hepatitis B infection. Question 7. A patient with pneumonia has a productive cough. What is the most appropriate nursing intervention? A. Encourage fluid intake. B. Administer antitussives. C. Limit physical activity. D. Provide a high-calorie diet. Answer: A. Encourage fluid intake. Rationale: increasing fluid intake can help thin secretions, making it easier to cough them up. Question 8. Which symptom is a common sign of a systemic fungal infection? A. Cough. B. Fever. C. Diarrhea. D. Hypertension. Answer: B. Fever. Rationale: fever is a common response of the body to systemic fungal infections. Question 9. A nurse is caring for a patient with MRSA. What type of isolation is required? A. Airborne. B. Droplet. C. Contact. D. Standard. Answer: C. Contact. Rationale. MRSA is spread by direct contact, necessitating contact precautions. Question 10. Which statement by a patient indicates a need for further education about antibiotic therapy? A. I should stop taking the antibiotics as soon as I feel better. B. I need to take the antibiotics until they are all gone, even if I feel better. C. I should take the antibiotics at evenly spaced intervals. D. I will call my doctor if I experience any severe side effects. Answer. A. I should stop taking the antibiotics as soon as I feel better. Rationale. This statement is incorrect. Patients should complete the full course of antibiotics to prevent the development of antibiotic-resistant bacteria. Question 11. A nurse is educating a group of students about preventing the spread of influenza. Which method is most effective? A. Wearing gloves. B. Getting the influenza vaccine. C. Using hand sanitizer. D. Wearing a mask. Answer. B. Getting the influenza vaccine. Rationale. Vaccination is the most effective way to prevent influenza. Question 12. Which is a common complication of a severe viral infection? A. Hypertension. B. Diabetes mellitus. C. Secondary bacterial infection. D. Hyperlipidemia. Answer. C. Secondary bacterial infection. Rationale. Viral infections can weaken the immune system, making the body more susceptible to secondary bacterial infections. Question 13. A patient is diagnosed with hepatitis A. What is the primary transmission route for this infection? A. Bloodborne. B. Sexual contact. C. Fecal-oral. D. Airborne. Answer. C. Fecal-oral. Rationale. Hepatitis A is primarily transmitted through the fecal-oral route, often through contaminated food or water. Question 14. A nurse is caring for a patient with varicella, chickenpox. What type of isolation is most appropriate? A. Contact. B. Droplet. C. Airborne. D. Standard. Answer. C. Airborne. Rationale. Varicella is highly contagious and spreads through airborne transmission. Question 15. Which symptom is most indicative of a lower respiratory tract infection? A. Sneezing. B. Sore throat. C. Productive cough. D. Nasal congestion. Answer. C. Productive cough. Rationale. A productive cough, especially if it brings up mucus from the lungs, is indicative of a lower respiratory tract infection. Question 16. A patient with sepsis is experiencing hypotension. What is the first-line treatment? A. Antibiotics. B. Intravenous fluids. C. Corticosteroids. D. Antipyretics. Answer. B. Intravenous fluids. Rationale. The initial treatment for sepsis-induced hypotension is aggressive fluid resuscitation. Question 17. Which practice is essential to prevent the spread of conjunctivitis in a healthcare setting? A. Using a separate bathroom. B. Wearing a mask. C. Hand hygiene. D. Limiting physical activity. Answer. C. Hand hygiene. Rationale. Good hand hygiene is crucial in preventing the spread of conjunctivitis, which can be transmitted through hand-to-eye contact. Question 18. A patient is diagnosed with mononucleosis. Which advice is most appropriate for the nurse to give? A. Avoid contact sports. B. You must wear a surgical mask. C. Drink only hot liquids. D. You should be active to boost your immune system. Answer. A. Avoid contact sports. Rationale. Patients with mononucleosis often have an enlarged spleen, which can rupture with trauma, such as that occurring in contact sports. Question 19. Which symptom is most consistent with early Lyme disease? A. A bullseye rash. B. Severe headache. C. High fever. D. Cough. Answer. A. A bullseye rash. Rationale. The bullseye rash, known as erythema migrans, is characteristic of early Lyme disease. Question 20. When educating a patient about preventing catheter-associated urinary tract infections, CAUTIs, what is the most important advice? A. Drink cranberry juice daily. B. Ensure proper catheter care and hygiene. C. Take prophylactic antibiotics. D. Limit fluid intake. Answer. B. Ensure proper catheter care and hygiene. Rationale. Proper care and hygiene of the catheter are critical in preventing CAUTIs. This includes regular cleaning of the catheter and the area around the urethra. Question 21. A nurse is caring for a patient with a suspected prion disease. What is the most important aspect of care for this patient? A. Isolation precautions. B. Antiviral medications. C. High-calorie diet. D. Supportive care. Answer. D. Supportive care. Rationale. There is no cure for prion diseases, and treatment mainly involves supportive care to relieve symptoms and maintain quality of life. Question 22. A patient presents with signs of a tick-borne disease. Which symptom would prompt the nurse to suspect Rocky Mountain spotted fever? A. A circular rash. B. A rash starting on the wrists and ankles. C. Constipation. D. Hypertension. Answer. B. A rash starting on the wrists and ankles. Rationale. Rocky Mountain spotted fever is characterized by a rash that often starts on the wrists and ankles and then spreads. Question 23. Which is the primary concern in the initial phase of septic shock? A. Hypoglycemia. B. Hyperthermia. C. Hypotension. D. Tachycardia. Answer. C. Hypotension. Rationale. The initial phase of septic shock is characterized by a significant drop in blood pressure, hypotension, which can lead to inadequate organ perfusion. Question 24. A nurse is teaching a patient about the prevention of hepatitis C. Which statement by the patient indicates an understanding of the transmission of hepatitis C? A. I should avoid sharing toothbrushes and razors. B. I need to cook food thoroughly. C. I should wear a mask in crowded places. D. I will avoid tap water while traveling. Answer. A. I should avoid sharing toothbrushes and razors. Rationale. Hepatitis C is primarily transmitted through blood-to-blood contact, such as sharing needles, razors, or toothbrushes. Question 25. A patient with HIV is prescribed antiretroviral therapy, ART. Which outcome indicates the effectiveness of the therapy? A. Decreased viral load. B. Absence of symptoms. C. Increased appetite. D. Normal blood pressure. Answer: A. Decreased viral load. Rationale: the effectiveness of ART in HIV treatment is primarily gauged by a decrease in the viral load, indicating that the virus is being suppressed. Visit nursestudy.net for more nursing practice exams, care plans, and study guides.